Which of the following organisms is the most common cause of early onset neonatal conjunctivitis? The correct answer is C, chlamydia. Several organisms can cause early neonatal conjunctivitis, but the most common cause is chlamydia trachomatis, typically appearing 5 to 14 days after birth. Question number 2. All of the following are changes that occur to the fetal circulation within minutes of birth, except for which? The answer is D, constriction of the hepatic portal sinus. The hepatic portal sinus does not undergo an immediate constrictive change right after birth. It's not a key shunt that rapidly closes in the transition from fetal to neonatal circulation. Question number 3. A 26-year-old at 30 weeks gestation presents with regular contractions and cervical change. She is diagnosed with preterm labor. In addition to corticosteroids for lung maturity, which medication should be administered for fetal neuroprotection? The answer is B, magnesium sulfate. It is given in preterm labor less than 32 weeks for fetal neuroprotection. It reduces the risk of cerebral palsy in the premature infant. Question number 4. The Fern test is considered positive for premature rupture of membranes when a microscopic sample of dried vaginal fluid shows a characteristic arborization pattern. This pattern is primarily caused by the concentration of The correct answer is C, sodium chloride. The Fern or arborization pattern seen in premature rupture of membranes is due to crystallization of electrolytes, mainly sodium chloride, when amniotic fluid dries on a slide. This creates the classic leaf or fern-like pattern under the microscope. Question number 5. Which of the following is not a typical complication associated with premature rupture of membranes? The answer is A, polyhydramnios. Polyhydramnios is increased amniotic fluid, which is the opposite of what happens in premature rupture of membranes. Premature rupture of membranes leads to loss of amniotic fluid, oligohydramnios, not polyhydramnios. Its complications include infection like chorioamnionitis, cord problems, low fluid effects like deformities, pulmonary hypoplasia, placental abruption, and others. Question number 6. A 24-year-old woman, 14 days after a normal vaginal delivery, reports her discharge changed from red to pinkish-brown and now yellowish-white without odor or pain. What is the normal lochia at the end of the second week postpartum? The correct answer is C, lochia alba. By the end of the second week postpartum, the normal discharge transitions to lochia alba. It is yellowish-white and consists mainly of leukocytes, epithelial cells, mucus, and bacteria. If the discharge is foul-smelling or persists as red, think of infection or subinvolution, not normal lochia progression. Question number 7. Which of the following laboratory tests is most commonly used in clinical practice to assess fetal lung maturity before delivery? If you chose A, you got it right. The lecithin-sphingomyelin ratio is the most commonly used test to assess fetal lung maturity. As the fetal lungs mature, lecithin increases while sphingomyelin remains relatively constant. The ratio greater than or equal to 2 generally indicates adequate surfactant and lung maturity. Question number 8. A 30-year-old woman at 38 weeks gestation presents with sudden onset painless vaginal bleeding. On examination, the fetal heart rate shows recurrent variable decelerations. An emergency ultrasound shows fetal blood vessels crossing the internal cervical os. What is the most likely diagnosis? The most accurate answer is D, vasa previa. Vasa previa occurs when fetal blood vessels traverse the membranes over the internal cervical os. These vessels can rupture. Because the bleeding is fetal in origin, it often leads to fetal distress, seen here as recurrent variable decelerations. Question number 9. A 31-year-old gravida, 2-para-1, with a history of preeclampsia in her first pregnancy, presents at 12 weeks gestation. According to current guidelines, what should be started to reduce the risk of recurrence? The correct choice is B, low-dose aspirin. Aspirin is recommended for women at high risk of preeclampsia. It is typically started at 12 to 16 weeks gestation and reduces the risk of recurrence by improving placental blood flow. Question number 10. A pregnant woman with intrahepatic cholestasis is under antenatal care. What is the ideal gestational age for planned delivery to reduce fetal risk? The right answer is A, 36 weeks. In intrahepatic cholestasis of pregnancy, there is an increased risk of sudden intrauterine fetal demise, especially in late pregnancy. Current practice recommends planned delivery around 36 to 37 weeks to reduce fetal risk while balancing prematurity. Like, share, and subscribe.